If you twist your knee and feel a loud pop, what's the likely injury? And what steps should you take to find out what your injury is? I discuss those questions in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Fairly simple question this week, but I know one that causes a lot of anxiety for people that get hurt. It comes from @grip3609. @grip3609 asks, I was playing basketball with the kids and went up for a dunk. My foot landed in a crack and I twisted my leg in an awkward way. There was a loud pop. What could the injury be? Okay, before I get into the specific answer to that question, just understand not just him, or her potentially, but anyone watching this video, I'm not giving medical advice. This is meant for general information and educational purposes only. So when you hear a pop, feel a pop, we're not really talking about like popping your knuckles, just a little bit of pop. We're talking about a loud pop, something audibly you can hear in your knee, potentially loud enough that somebody else can hear it, but also a loud pop that you can hear, especially when you combine that loud pop with that mechanism. You land awkwardly and twist your knee. That is almost always a torn ACL, anterior cruciate ligament. There are really very few other injuries that can do that. I suppose a fracture, a broken bone, but you would know that because it would be crooked and significantly out of place almost all the time. But a torn ACL, that twisting injury, landing awkwardly from a jump, or you're running, plant your foot and turn and you feel a very loud pop or hear a loud pop, very likely an ACL, especially if it swells up significantly within the first hour. Not just a little bit of swelling, but very big swelling. That's almost always an ACL. Could it be an MCL? Maybe. Those typically have a little bit of a pop, but not to the level of an ACL. PCL, other ligaments in the knee, typically not. I suppose a patellar tendon rupture could do it, but that's more a sharp, painful, tearing sensation more than a pop. You don't typically feel a pop or hear a pop with patella tendon, but that potentially could do it. Meniscus tear, no. There really aren't many other things. Even like a dislocated patella typically is not going to cause a loud pop. You think by far ACL tear. Could it be something else? Yes. But as far as likelihood, you'd certainly bet on ACL tear. Likely something that you would go see an orthopedic surgeon, orthopedic sports medicine surgeon, find out in a clinical exam, potentially an MRI in rare circumstances, to find out the nature of that injury. Okay, if you want a copy of my ebook, The Arthritis Solution, you can get that free by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, click the link in the description under this video, fill out the contact form, and learn more about potentially scheduling an appointment with me. I'd also love to hear your experience with your injury, ACL or otherwise. Leave those in the comments below. Just understand, if you leave me a question in the comments, I can't offer you medical advice, but I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my next live stream, my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.